next session, which is applying as an IMG. My name is Marcel Brus-Ramer. As I mentioned, I'm one of the co-founders of Elite Medical Prep. I went to medical school at Columbia, did an MD PhD, and then did my radiology residency and fellowship training in neuroradiology at UCSF, and now do teleradiology. I have with me, I'm really lucky to have with me today, Dr. Alina Khil. Alina, do you want to introduce yourself? And then we're also have Dr. James Booth, who's going to continue on with us, and maybe some of our other team members as well. But Alina, go ahead.
Yeah, hi everybody. My name is Alina Khil. I am a senior tutor and residency advisor at EMP. I went to Case Western for medical school, got my MD there. For residency, I'm at UCSF Fresno in general surgery, and I have completed 2 clinical years. I'm currently in research, and yeah, excited to get started here.
Awesome. And once again, for those of us just joining, Dr. James Booth. I'm a senior tutor and residency advisor here at EMP. I did my undergrad at Columbia, med school at West Virginia University in my home state, and went up to internal medicine residency at Dartmouth. And I've been working as a faculty member in the Department of Medicine at Johns Hopkins Hospital for the past year now, where I also sit on the interview committee and the final rank listing committee for our internal medicine urban health primary care residency.
Sorry, and Dr. Booth, I forgot for some reason the disclosure slide for you was not let's see if that's yes, here yes, it is in here. We just put it in a different spot. So let's go to the disclosure slide so you can just say that, because I know you need to do that, and then we'll go back to the overview and jump into the slides.
No, absolutely. Thank you. And so as you can see here, just a quick disclosure that, like I said, I do sit on that interview and rank listing committee for one of the residency programs in internal medicine at Johns Hopkins. And so I'm here today contributing and giving advice and recommendations as a member of this company, EMP. Has nothing to do with how I would view or evaluate applications per se, for Johns Hopkins specifically. Thank you.
Okay, great. So just going in overview, we're going to talk about some statistics, some visa considerations. We'll mention that briefly, where to apply, taking step 3, U.S. clinical experience, and Dean's letter. There's a lot of material we're going to cover in a shorter period of time, and obviously there are lots of questions. We'll try to have an extended Q&A. So this is our last session of the day, so bear with us and please keep posting your questions as we go. Let's go to the statistics. I'll handle this, Alina. What we realize is that, and if you recognize and look at some of the information online, we hear that it can be more challenging as an international medical graduate or foreign medical graduate, whichever term you prefer, to be able to get a match. Now that, yes, the match rates are lower. However, we can see over time that match rates for international medical graduates have been gradually increasing over time, both in number and in percentage. There are different numbers, different percentages, as stated on the slide here, for those who are U.S. citizen international medical graduates, meaning people who are born in the U.S. or have a U.S. passport or U.S. visa, permanent resident visa, and then go abroad for medical school. That could be in the Caribbean, that could be in Europe, that could be in another part of the world, versus those who are non-citizen or those with non-permanent resident status visas, and then come from an international medical program. But overall, there's a trend of increasing number of matches and also a percentage match rate. Okay, so there is positive news with time, and that's I think that reflects an increased need for physicians of all from all over the world in order to supply the need in the U.S. for physicians. So it's important here that when we're talking about when you're applying as an IMG, that you want to ensure familiarity in your application and in your essay. And what do we mean by that? And so in discussing with some of our senior tutors and also with experience with our students who are coming from international medical schools and they're international medical graduates, we want to make sure that the personal statement essay that you're submitting has spelling and phrasing that is using U.S. conventions rather than, say, British conventions. Many people who may be coming from abroad may be coming from Commonwealth countries. Those are countries that were formerly part of the British Empire, and so there may be other conventions in phrasing or in spelling. They may use British spelling. They may use a British spell checker because that's what they're used to in their clinical experience or medical school experience. It's important that you switch to the U.S. convention. You want to make sure things are as easy as possible on the people reviewing your essays and your applications. It's also very important to have a native speaker preferably somebody medically trained in the US to review your application, review your essay, to make sure that there is nothing that sort of comes off a little funny or a little strange. The last thing you want is somebody caught up in the wording or phrasing that you have and sort of making them think, this is maybe somebody who's not familiar with how the US system works. Speaking of which, next bullet point here says, be familiar with US speaking style and US terminology. And what we're referring to is you want to be able to feel comfortable in your interviews and in your interactions on your rotations, but also particularly when you're in your application, so that you can show the programs that you're applying to that if you end up matching as a resident there, you're going to fit in seamlessly, just like another member of the team. You're going to bring the great diversity of your background and experience, but also there's going to be a good cultural fit, and there are not going to be issues that may cause unclear interactions in patient care or otherwise. So it's, again, this generally crops up where we have students who may be familiar with the British terminology or British style or Commonwealth style of interactions, and then there's a difference in the US style. So things that can help are just being generally familiar with US culture. I think most people are through various forms of media, but this is something you may want to review and just brush up on before you get to that step. Okay, so Alina, do you want me to go ahead and take this next slide, I guess?
I can go over it.
Yeah. Okay, please. Please go ahead.
Yeah. So essentially, you have to also make sure to apply wisely, and this goes for US applicants too. We always recommend applying broadly, as we spoke about earlier, applying to many different programs, not just the top programs. But the other thing you have to consider for IMG is that there are essentially certain programs that are more IMG friendly. There are certain states that are more IMG friendly, and you can find all of this information online. There's quite a big list of different programs that are IMG friendly. So you can also speak to any other IMGs that you know and see where they're applying, or where other people have had success applying to and matching. Essentially, by doing this, you will increase your chances, because you already know you're applying to programs where you actually have a better chance of matching versus maybe some other programs who don't accept IMGs very often. And of course, still consider the competitiveness of the specialty. Some specialties will be more competitive. You may need to apply to a lot more programs, and other specialties may not be as competitive. So that's essentially another thing to also consider as you're applying.
Yeah, I can sort of chime in on that the bottom bullet point here regarding finding programs that are IMG friendly. I did my internship. Maybe I didn't mention this up front. I did my internship at St. Luke's Roosevelt, which is now part of the Mount Sinai West program. That program, I believe, and I did my prelim year in internal medicine. I believe nearly 50% or more of the internal medicine residents were from foreign medical programs, either from the Caribbean or elsewhere, and that would definitely be considered an IMG friendly program. Recently, we were talking with a tutor applicant who mentioned another program. A lot of these programs tend to be in the Northeast. That's also just, there are, I think Dr. Booth can weigh in here particularly, that tend to be a lot more programs in total number in the Northeast part of the United States. And so therefore there may be more in those states such as New York, Pennsylvania, New Jersey, et cetera. But looking for that 20% or greater number is a good indicator that a program is that way. Dr. Booth, did you want to jump in here?
Yeah, absolutely. I completely agree that like the greater New York area, so Long Island, New York City itself, downstate New York, like Westchester area, New Jersey, basically the I-95 corridor. A lot of programs that really attract people, who did med school outside the United States. And I also will definitely hone in on what you mentioned about like that example of, formerly known as St. Luke's Roosevelt, now Mount Sinai Morningside or Mount Sinai West campus. A lot of big name like academic university programs often have a large spattering of satellite or like affiliated sites that are not like the main site. So like UT Austin has the main site at UT Austin Dell Medical School. They have a whole bunch of other sites in Texas, and these are good programs. These are places where you're going to get a good medical training. Like you're going to be well trained, and they often can be more IMG friendly is what I would say. Like Dr. Brus-Ramer was saying, they often are going to have a larger proportion of their residency body be people who trained outside the U.S.
Okay, great. So let's move on to taking step 3. Dr. Khil, do you want to lead us
Yeah.
through this slide?
Yeah, absolutely. So in terms of taking step 3, normally people who go to medical school in US, we don't actually take our step 3 until our first year of residency, until our intern year. And the program usually has to give you some time off, so a few days off in order to be able to take the exam. However, if you are an IMG, you should really strongly consider taking step 3. And for some of the visas, for H-1B and O-1A visa, you will actually be required to take step 3 for that. But overall, even if you're not required, we do recommend that you take it. This will essentially not only serve as another measure of your knowledge, but also now the programs won't really have to worry about giving you that time off. So that's one less thing for essentially for them to have against you. And in terms of kind of scores for this, so there's not really any that will really vary by program, and it's not really there's no WMC data on kind of averages or anything for step 3 scores. They only have it for step 1 and step 2 scores. So definitely look into the programs that you're applying to and see if they have any sort of averages for that. And I think we can go on to our clinical experiences. Yeah. Yep. Sorry, Marcel.
Oh yeah. Okay. Sorry. Did you want to go ahead and take this? You feel free. I can talk through this.
Yeah.
Because we. Oh, okay. So with regard to clinical experience, we've had this question earlier in the sessions today. I just want to be very clear. We've made sure to check the research on this, because in looking this up, it was very important. There's been questions about are there a standard minimum number of US clinical experiences that are required. And if you review very carefully the ECFMG website, there is no listed standard minimum number of US clinical experiences. What you do find when you're reviewing this information on official websites from official organizations, not from paid organizations, is that you see that the minimum numbers, if they are listed, are program specific. So this is something you will need to research individually with regards to that. Dr. Khil, I don't know if you want to walk us through the remainder of the slide, but I wanted to make sure to touch on that call out box we had at the top of this slide before we moved ahead.
Yeah, absolutely. I do this slide. With this slide, I really want to highlight the differences between electives and observerships. Electives are generally going to be a much better experience, and this is actually somewhere where you can get a letter of recommendation. This is also something US graduates do as well. During 4th year of medical school, they go through electives for particular specialties that they are applying to, and you can do these electives essentially at programs where you wish to match, where you want to get an interview. Sometimes programs will even give you an interview just for rotating there, and at times they even do kind of an unofficial interview with you while you are at the elective. So in terms of kind of requirements for these electives, so step 1, step 2, it would be really great to have these scores before you apply for electives. And overall, US hospitals will essentially tend to prefer people who or applicants who are more familiar with the US hospital culture. So doing an elective in the US will be really helpful, so they can see that you are familiar with how things are run at US hospitals. So while there are no kind of standard minimums, I think for the majority of specialties, having at least one elective will be great, will make you competitive. I know for general surgery, they really like to see at least one, usually more than one, for these electives. In terms of observerships, so observerships, you will not actually be able to have kind of any sort of say in patient care. You won't really be directly caring for patients. You essentially just pay money. You're there to watch and it will be incredibly difficult to get a letter of recommendation from observerships. So while this may be good to kind of observe and see what an elective may be like, keep in mind that you will likely not be getting a letter of recommendation from that, and you will actually not really be involved in patient care. And then on our next slide, so we also have, in terms of applying to electives, and this process is actually similar to applying for electives for US graduates too, but overall there are some requirements that will be the same no matter where you are applying or what specialty you are applying to. Things that you will absolutely need before for your application to electives: a CV, a personal statement, a letter of intent, and this will also be specific to programs. So for each program that you are applying to, you will need to write a separate letter of intent. Certainly look into the program, see what they have to offer, and try to make your letter as relevant to that program as possible. You will also need a dean's letter. This is different from the dean's letter that you will have for your actual residency applications. For electives, essentially, this dean's letter needs to say that you are in good standing as a student, you will have all the requirements prior to taking part in the elective, and that you are permitted to, by your school, to take part in this elective. And you can also, templates of this are available online, so you could also look into that to make sure that it will include everything that you need. This dean's letter, it can also serve as a no objection letter during for your visa interview. So that's a kind of a dual function there for that. Immunizations, there is a list of required immunizations that you will need. Proof of health and malpractice insurance. So for this, essentially, you will need to purchase health insurance and malpractice insurance in the US. What you can do prior to purchasing it is you can actually write a letter to the clerkship coordinator and tell them that you are intending to purchase this insurance once you have secured a spot at the rotation. And in most cases, this will be totally acceptable. And they understand that that you would be able, that you're essentially waiting to do that until you actually know that you will be coming here for sure. Other things, so training, BLS, HIPAA, OSHA training. This is something that we all do as a med students, as medical students in the US. And overall, for us, this is something that the med school usually will offer. However, these trainings are all available online, so you can complete all of them online. Just make sure they are where you are completing them. Make sure those are programs that will where their certificates are actually acceptable for applications. And finally, some programs will ask for a urine drug screen test. That will really kind of need to be timed. There's, I believe, a 3 months kind of limit on that. So that's also something to consider as you're applying in terms of timing that. At the end, of course, there can always be more requirements depending on the program and depending on the specialty. In terms of where to apply for these programs, VSLO or Visiting Student Learning Opportunities website is a website that has a lot of the electives. A lot of programs will be on there. Some programs will not be, and for that you will essentially need to go through the program website and get the application from there, get in touch with the program if you need to, and ask them how you would go about applying and what requirements they have. So overall, always check well in advance with every program you're going to apply to. These elective spots do fill up quickly, and the more prepared you are ahead of time, the better the chance you will have at securing a spot in an elective.
Great. So I'm going to just talk about this dean's letter, or maybe even call a pseudo dean's letter. And this is something that we bring this up because This is an issue that may be an issue for those students who are going to foreign medical schools that are not familiar with this sort of system, or not familiar with the standardized writing. If you go to a school, say in the Caribbean, where they are oriented towards putting graduating students and having them match into residencies in the U.S., then this would not be as much of an issue. However, there may be schools in other countries where they're not as familiar with this, and so it's important that you have a good dean's letter written in the correct format. There's a template that's available on the ECFMG website, and it can allow and help your medical school to write it correctly. You're going to need to be proactive on this process. A lot of the things, this is a difficult process. If you're coming from a foreign country and coming to the US, you need to be proactive on a lot of things. You may want to consider pre-writing this, although this is technically not allowed. The idea may be sort of bullet pointing it so that you can help to align the faculty and make their job a little bit easier. Another very important point, and this is from a cultural perspective, is you need to explain the dean's letter terminology. This is very important. Remember that in the U.S., satisfactory or good in the U.S. may reflect poor medical student performance. This is just the way the terminology is used. Whereas excellent may be a good student, and superb or outstanding really actually means an excellent medical student. Other countries may have different sort of standards of translating, and so simply using Google Translate to switch the language over is not going to be sufficient. Ensure that the formatting is correct. Also, very important, always the best information comes from your peers. So talk to other students, international medical graduates who, from your medical school who've gone on to the US. If you can talk to them about their process. Of course, you need to stay updated on the ERAS system. That was part of the earlier sessions, was just getting updated. There's constant change going on. This is constant updating. It's a moving target. So you're gonna need to be very proactive throughout this process. We're gonna have time at the end for Q&A. I want to make sure we got to the end of our set. We're just about the end of our session. I think we've got an overview. We've talked about some helpful. We've talked about a lot of different things here that are going on. I guess this checklist is not really needed at this point. So at this point, we're going to roll into our question and answer session. Dr. Booth, Dr. Khil, I know this is a great opportunity. We've had lots of questions. Maybe you guys want to take it away, and I'll mute myself on these, because I think you're both much closer to this and can answer, but from a surgical and a medical perspective, on some of the questions we've had so far.
Thanks. I wanted to quickly address a question that actually came up a couple times in the Q&A section here, which was essentially like, what if you have a US-based physician who you have done work with essentially abroad, like, in your home country or the country you did your medical school training? Well, is a letter of reference from them still desirable and or valid? I would say absolutely. Absolutely. I mean, like, again, it goes back to what we were talking about earlier about quality of letters is what really matters. And so if you have someone who you've done like longitudinal work with, doing clinical work, whether it's in the United States or abroad, especially if they're a US-based doctor, that just strengthens it. If they can talk to your talents and your experience and your passions and in a way that's meaningful, then that sounds like a strong letter to me, right? I mean, I don't know if you guys think differently, but that'd be my perspective.
No, I absolutely agree with that, and I totally agree with quality of letters. I remember when I was being interviewed that actually some things from my letters were brought up, and they were kind of just like unique things that you wouldn't see in other students' letters. And I think somebody who knows you better, who you've really worked with, can certainly make that letter more unique and more specific to you, rather than kind of writing a general letter.
There's a question here that I want to answer live, which is if letter grades are used for clerkships, but the grade is what it is. It seems on the surface like it might be not that good, but it's actually like the top of the class. How do you perceive that? That's an awesome question, actually. And for the US MSPEs, they have to provide information on how you compared to people in the class. Like, so if it's honors pass fail for a clerkship, for example, US MSPEs have to say like 25% got this, 50% got this. They have to show that. So if there's a way to show how you did compared to the class, like, that you were really like actually doing very well, then that's something you want to make sure that's highlighted. They're not going to care about the letter grade if it's saying they got a B, but B was because of the curve was actually the top of the class. So that would be what I think on that.
Yeah, I agree.
Oh, I wanted to get this. There's one question I've heard in a couple of different formats, and maybe this is important, particularly specialty specific, would be How many programs to apply to? Do either of you have any input on this, on how many you would consider applying to? Maybe both as a U.S. medical graduate and then also both U.S. medical graduates, and then also as a foreign medical graduate, how would you consider that?
Yeah, I can answer that. So I know for surgery, for me personally, when I was applying, when my colleagues were applying for general surgery, we were applying to about 50 or 60 programs, and that's for US graduates. My colleagues who were applying to more competitive specialties like orthopedics or dermatology, they were applying to every single program in the US. So for those kind of specialties, I would highly recommend doing what my colleagues did and just apply to every single program. It's very common for US graduates to be applying to a lot of programs, especially for specialties that are more difficult to match into. In terms of specialties that are, less difficult to match into, I would still shoot for at least 50 programs. As an IMG, I would maybe even put that number up to 70 or 80 programs. Dr. Booth, do you have any input?
Yeah, so I agree with everything you said, and it's funny. I as someone who personally reviews applications and does interviews and all this, we all bemoan application inflation, but what is it? Iced tea. Don't hate the player, hate the game, right? So I mean, if you're an IMG applying into a more competitive specialty, I would consider applying to as many programs as you can manage. If you have a very, very strong application, and you're applying to something like internal medicine, pediatrics, family medicine, programs that are a decent bit easier to get into, less competitive per se, then somewhere between 50 to 100, like Dr. Khil said, could be appropriate. So maybe the first step is where you're applying, and then what sort of residency you're applying into, and then getting maybe a frank assessment from a good trusted mentor, and doing a self-assessment as well about how competitive your application is, are going to be good guiding principles to start with.
Okay, we're coming up on time. We have about a minute or two left. I just wanted to tell everybody, to really thank everybody for attending today. This has been a really fantastic residency roundtable. We plan to have additional supplemental sessions on a number of topics that we've covered. Some we covered today, and some we haven't necessarily covered, but there'll be some additional sessions that we recorded. There'll be opportunities to send in questions and information. Obviously, you can reach out to us for a consultation, potentially to work with one of our excellent advisors. Dr. Booth and Dr. Khil are both excellent advisors that have a lot of experience for helping us sort of shepherding students through the residency advising process through all phases. And we have lots of other fantastic team members here. But again, thank you so much for your attention. We're going to stop the recording now.